If it should happen, you have to go to the emergency room right away. Testicular torsion is so serious, I needed to do a video just on this. Guys, I'm Dr. Jen.
Young men and boys,
People assigned male at birth, and for women who have
males
in your lives, you need to understand the potential symptoms of testicular torsion. Testicular torsion, it's a serious and painful condition that affects the testicles. Usually just one. It's possible it can affect both, but that's rare. But one. And by the way, the condition is rare in and of itself. But if it should happen, you have to go to the emergency room right away. What's going on here with testicular torsion is the spermatic cord twists and cuts off the blood supply, the blood flow to your testicle. Now you can imagine if blood flow to the testicle is cut off, your testicle is not getting blood flow. You could lose that testicle. It could die. Okay. If you can imagine almost like a garden hose, okay, those old school garden hoses that I certainly had when I was a kid. If you kink the garden hose, the water doesn't flow out of it. That's the same thing with the spermatic cord if it gets twisted and cuts the flow of blood off to the attached testicle. Blood flow is crucial to organs, to our body, to our lives. It's also crucial to the testicle in and of itself. And if that blood flow isn't reaching there, that testicle can die, okay? The testicles are reproductive organs in the scrotum, right? The scrotum is basically the sac of skin beneath the penis. And inside the scrotum are the two testes or testicles, okay? Each testicle is connected to the rest of the body by a blood vessel called the spermatic cord. Testicular torsion, which is what we're talking about here, happens when that spermatic cord becomes twisted. Testicular torsion can happen to boys and men of any age, okay? But it's most common in boys 12 to 18 years of age. It can happen after exercise, while somebody's sleeping, after injury to the scrotum. Sometimes we don't have an apparent cause. Again, we're talking about this because it's a serious medical emergency. So you're probably saying, well, how would I know that this is going on? First of all, sudden intense pain in one of your testicles. Go to the ER right away. Do not play around, okay? Because the thing about it is sudden intense pain in the testicles could very well be testicular torsion. And the risk of losing that testicle, the testicle dying, increases the longer you wait to get treatment, okay? So you need to go to the ER right away. Symptoms. Let's talk about how you would know, okay? Sudden, severe pain in one of your testicles. It can happen anytime. Doesn't matter. Sudden, severe pain, ER right away. In the ER, they can do tests, obviously, to see if your spermatic cord is torsed, if it's twisted, if the blood supply to the testicle is being cut off, okay? It feels like a sudden intense pain in your testicle. Sometimes that pain will radiate to the stomach or make you feel like you're nauseous or you want to throw up. You may have problems even walking because of the pain is so bad. We're talking severe, like 20 out of 10 pain, okay? Sometimes it's an intense pain that comes and goes. But listen, once again, intense pain at all is the emergency room, okay? Sometimes there are other symptoms, painful swelling on one side of the scrotum. Maybe you have a lump on the testicle. Maybe one testicle is higher on the scrotum than the other. There may be like a discoloration of the testicle, okay? Red, purplish, brown, black, abdominal pain, maybe increased urination, fever, okay? But I keep driving this point home. Sudden intense pain in one or both of your testicles, ER, like ER ASAP, because you need intervention to make sure that that testicle doesn't die, because the concern is testicular torsion, right? It may not be testicular torsion, but the ER can do tests to make sure that it is not. And again, that means blood supply being cut off to the testicle, which can cause it to die and you losing that, okay? How is it fixed or what do you do? Surgery is what needs to be done here. So it's a surgical emergency. A surgeon will evaluate you, and if you have testicular torsion and you need surgery, they will do what they need to do. Most important thing is to understand if you have these symptoms to seek medical care right away. That is the PSA. Let me know what you think. Subscribe to my channel. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, Threads, etc. Find me there. Also go to my website, drjencaudle.com, to sign up for my free health newsletter. Guys, I hope this is helpful.